have a shortfall of staff in various areas, and that's why events like today are really important. We've got to start with young people at school. We've got to get into their minds around planting the seed, health and social care. It's not just about doctors and nurses, it's over 100 different occupations on your doorstep that you could access.
The Medical Health and Social Care Academy is there to be able to provide sixth form students the opportunity to be able to gain additional experiences outside of the regular A-level curriculum. At that point in time, they're able to gain experience from our working professionals and partners through the NHS, with Hull and East Yorkshire Hospitals, City Healthcare Partnership, Humber Foundation Trust, Yorkshire Ambulance Service and Hull City Council.
We put a number of events on in order to help those people to make the right career choices to come to university.
£28 million invested in a building that brings together research, brings together the whole York Medical School, all the health programmes and clinical skills.
Probably about 97% of the care we give is funded by the NHS. So we're what's called the social enterprise, so we're like a private business, but we have a social value. So everything we do is about investing in people's health and well-being, in our workforce, to develop our workforce. Employees are actually shareholders in the company, so when you start in the company you buy a share for £1.
The programme that we offer is available to all possible students in Hull. They'd come to us to be able to join our sixth form and at that point in time take advantage of the Medical Health and Social Care Academy opportunities. Those opportunities are unlike any other sixth form is able to offer because we allow students the ability to be able to gain professional experience, not only by finding an NHS mentor in their chosen career path, but also gaining work experience within those organisations as well.
We had 249 adult nursing students started. Adult nursing students. We had 32 mental health, 32 children's nurses, 15 learning disability nurses, 31 midwifery students and 37 operating department practitioner students.
A great deal of talk about the number of extra GPs that we need in general practice, but I don't think that is taken into consideration the number of GPs that are going to be retiring as well. So any addition to the 5,000 that the government think that we need, we're going to need more than that because 27% of GPs in Hull are of the age of 55. So over the next 5 years or so, that's a quarter of the workforce. And so we have got a workforce problem at the present time. It's not going away, we've got an increasing one in the future.
About 45% of our NHS workforce are over the age of 50. So that gives us some real challenges, as many of those will be registered nurses, for example, and they can retire at the age of 55. So if many of them retire at the age of 55, then we lose a lot of experienced professional people who have real knowledge of the system and of the service and delivering high quality care, as well as losing leaders.
What we need to have is a mixture so that we have young people as well as old people working for us in the trust, and we encourage the employment of young people. And we have an apprenticeship scheme where we can bring people through that way. We can give people work experience in the trust.
So there's lots of entry routes into working at CHCP and in health. Not all rely on going to university, so we offer apprenticeship schemes. People can apply directly via NHS jobs for a range of careers that don't all require a degree or A-levels.
You could undertake a vocational qualification, a BTEC, at either level 2 or level 3, depending what qualifications you've got, or a higher national diploma, higher national certificate. Alongside of these programmes, you can go on work placement for 200 hours, and through organisations that we've already got contacts with, they will then internally put you through their own programmes. So you'll be undertaking a whole college programme, our placement, and then they'll put you through some little certificates that then will take you into the NHS.
We employ 8,500 people. We see 650,000 patients from Hull and East Yorkshire, but because we are a specialist, we're a tertiary centre, which means we also provide services in terms of neurosurgery, cancer, vascular, major trauma. We serve the population of Grimsby and Scunthorpe, so we have that population is about 1.2 million.
And I'm responsible in the organisation for making sure that we recruit people who have got the right values and the behaviours that we need in the NHS, who are able to provide caring and compassionate services to our patients.
We are the first in the entire country to be able to join in partnership directly with the NHS providers, as well as higher education providers, to be able to offer students the extra advantage to be able to find out about health and social care careers.
Obviously the medical academy is something significant that a lot of colleges don't offer, so that's one of the main reasons that I go to St Mary's College.
As an organisation, we really invest in our apprenticeships. We have over 100 apprentices at the moment. We have an award-winning scheme. We want to double that apprenticeship number to over 200, and we're going to be doing that by using the apprenticeship levy.
The recreational coordinator apprentice, so that's what I did for a year, and then I've been lucky enough to have the post be made permanent. So now I manage new apprentices that come in, so we've got 2 new recreational coordinator apprentices and we've got nutritional apprentices as well.
Like my actual studying of the MVQ has to last 12 months. I've been at pathology at Hull Royal for 10 months.
You know, we've got many nurses that started their careers at the bottom of the pay scales, but they're now nurse managers, they're specialist nurses, and they're earning, you know, good salaries.
She actually comes back now as a guest speaker. She left school not knowing what she wanted to do. She randomly enrolled on a level 2 health and social care. From there progressed to the level 3, and then she went into the NHS, and she's now one of the directors of the NHS, and she actually did in-house qualifications without going to university, and she actually then went via the NHS to their own nursing degree, and she's now one of the directors of the local East Riding and Hull.
Roles such as health visiting, school nursing, district nursing. We also have dental therapists, we have dietitians and dietitians assistants, we have clinical psychologists, mental health and wellbeing practitioners, stop smoking advisors, weight management advisors, so a full range of quite diverse careers, all with different levels of qualification that you need to get in.
98% of students are employed 6 months from graduating from across the university, but in health, in some of our programmes, this achieves 100%.
We've got apprenticeships, you know, in our mortuary services, in our neurophysiology department, as well as HR, finance, IT, etc. But we're going to be doing it in nursing, physio, OT. So you could actually leave school, come and be an apprentice. There needs to be a commitment. You're going to continue with your education, but there's a real opportunity there. So you don't have to go to university, but it doesn't mean you can't come into health and social care. Of course you can. So we just need to make sure that that career path is open and people understand it, so they can come into Hull and East Yorkshire hospitals.
So of course what people are most concerned about is the repayment of student loans, because that's new for these professions. And what we know is that on a new salary in these posts in the NHS, people will be paying on average about £5.32 a month out of their salary.
I want to be a GP when I finish sixth form in university.
We've got our links with St Mary's and the Medical Academy. So go along to an open day, go and have a listen and go and talk to the staff there.
And so I went to one of the Medical Academy events and spoke to a couple of GPs, and I went home and did more research on GPs and just sort of stuff to do, and that's when I decided to try and take on chemistry, and I was confident with it, so I decided to try and join the Medical Academy, and I was successful, and that's how I've got to here.
I still want to be a GP, but it has made me realise, like, if I ever change my mind, there's so many different options of like what I'm interested in, like mental health or oncology.
There is a career, not just a job, but a career that would pay well, but more than that, it's training and development, there's good leadership, you know, you can come and enjoy your environment, and that's the message that we need to get across. So I think when we start doing that, we'll be able to get more people into the sector.
You'll never be bored, it's incredibly interesting and very, very enjoyable as well, so I wouldn't regret doing it for a minute.